All right, welcome everyone to our North Dakota Nursing Education Supply and Demand Chartbook webinar. I'm Patricia Moulton. I'm the Executive Director of the North Dakota Center for Nursing. And today, like I mentioned before I muted the call, we are presenting this on mute. You can type in questions into the chat box. We will also unmute the lines at the end of the presentation for questions. And just to let you know, we are recording this presentation and it will be posted online later today. Today, I am going to be talking about some results from our 2016 Chartbook. It can be found on our website under our Nursing Workforce Research tab under our platforms. We have actually been conducting nursing workforce research, or myself, since 2002, beginning with the North Dakota Nursing Needs Study. This 10-year longitudinal study was funded by the Board of Nursing, and reports from that study and the Chartbook I'm discussing today can all be found on our website. There are some additional data sources for this report. We pull a lot of information from the North Dakota Board of Nursing licensure files, annual reports, and annual education reports. They can all be found on their website. We also pull Job Service North Dakota labor market information and also jobsnd.com job openings data. We also have included some Center for Nursing 2013 hospital survey results and also Center for Rural Health 2014 hospital results. We also include U.S. Bureau of Labor Statistics data and U.S. Census Bureau population estimates. So today I'm going to talk about the organization of the webinar and the Chartbook. The Chartbook is organized by education, supply, and demand sections. We also have a section on projections, recommendations, and today I'm going to talk a little bit about our Center for Nursing strategic plan. So to start with nursing education and our education programs and students. Currently in North Dakota we have 16 nursing education programs, including preparation for the LPN, RN, advanced practice nurses, and other graduate programs. There's also a new post-licensure program at Mayville State. As an update from the Chartbook, Turtle Mountain Community College, which is up in Rowlett, recently closed their program in August of 2016. So if you're throughout the state, you can look to see where the stars are for where your program is located. As far as the nursing education programs, there's a total of 990 admission slots for the last year of data that we utilized. And this is for all the practical nurse and the registered nurse programs. As far as applications to all the nursing education programs, they actually received 1,803 applications in the last year. You'll see those have been pretty steady throughout the last 5 years or so, with a slight increase, or actually a slight increase from the year before for the baccalaureate RN programs. But when you look at the number of applicants that were actually received at the programs, and then that were actually accepted and then enrolled in the program, you'll see that for our baccalaureate RN programs, which is the green line, most of them are over 100% admitted, which is above the number of seats that they have in their program. And you'll see that by and large, most of the programs are pretty full. You'll see that some of the LPN and the associate RN programs, waver between 81 to 96% full. As far as those that are enrolled that are male or minority, you'll see that LPN programs have the greatest enrolled minority students, and RN programs have the greatest number of male students. And the minority students has increased over the last 5 years. As far as graduate trend for the LPN programs, and in the Chartbook and on this slide I list all the LPN programs, you'll see that across the years they've been maintained pretty stable as far as total number. You'll see in 2004, 2005 that there's only associate LPN programs. That's because that is the very beginning of the change in the scope of practice in the Licensure Act, when there started to be certificate LPN programs the next year. As far as RN graduate trend, there's 5 colleges that graduate students with an associate's degree, and then there's also 8 colleges that have bachelor's in science of registered nursing, And you'll see that there was quite a bit of an increase from 2004 to 2013-14 as far as the number of graduates from those programs. For the master's and doctorate level graduation trends, you'll see that this alternates quite a bit from year to year. Some of it is because some students take longer to graduate versus others. And as far as the percentage of graduates below 25 years of age, you'll see that has dropped since 2009, indicating that our graduates are older students. Sometimes this can also indicate you have more non-traditional students in some of your programs. As far as the pass rates for the board exam, all of our programs, our LPN and RN programs, they're above the national average over all of the years. You'll see the red line is the national average and the blue line is ours. So by and large, all of our programs certainly have an excellent pass rate. So as far as nursing program faculty, this is the number of full and part-time faculty across the years. And you'll see between 2004 and 2013, if you just look across that 10-year time span, we've actually had a slight reduction in number of faculty. And of course, this alternates from year to year based on availability and course size. As far as faculty position openings, you'll see that we recently have started an uptick in the number of open positions for faculty for each of the programs, and an increase in the faculty vacancy rate trend. As far as the number of faculty positions filled by unqualified faculty, the Board of Nursing actually has a program for those that report unqualified faculty. The faculty are required to be on a program to get a graduate degree while they're teaching. You'll see there has been also a recent uptick in that. So this indicates that a lot of the programs are needing to fill some of their open positions with individuals that don't quite have all of the qualifications in place yet. You'll see our faculty diversity trend. You really can't see much on that slide, and there's a good reason for that, and that is because they're by and large Caucasian, with a very small number of Native American and other diversity. As far as gender, it kind of looks the same, mostly female faculty across the board. As far as age goes for faculty, you'll see in the last 3 years, there's been an increase of faculty between 25 and 30 and over 61. So certainly we have some new faculty coming on board, and certainly we have quite a few faculty that are also getting to retirement age. We also looked at faculty salary budgets. Every year, the North Dakota Nursing Education Programs report, among all of their information, they also report how much of their salary is spent on how much of their operating expenses is spent on salary versus other operating expenses. And you'll see that for the North Dakota University System programs, they have not risen as much as the tribal and private programs over the last 5 years. We have also pulled salary information from jobs, the North Dakota Labor Market Information Center. And you'll see that the entry-level salaries, which is the blue line, are quite a bit below the national average, which is the black line. You'll see that the average salary is roughly around the average, and the experienced salary is also shown in that graph. But when you compare nursing faculty salaries with other faculty, this again is from the Job Market Information Center. And this is all of the different post-secondary faculty salaries for all the different disciplines. You'll see that nursing faculty have the 15th as far as salary, and this includes a salary that's lower than all the other health profession faculty. And according to the Labor Market Information Center, nursing faculty are a bright outlook and exceptional growth. And by the way, all of the nursing occupations are either a bright outlook or exceptional growth occupation across all of our different nursing occupations. I'm going to turn to nursing supply now and look at the number and distribution of nurses. And so we have produced these maps since 2002. And these maps are designed so that wherever you are at the state, you can see how healthy of a supply you have for nurses. And by and large, over the last 14 years, we've always had, if you look at just the number of nurses across the whole state, we always have a pretty healthy supply of nurses as far as statewide. In fact, we have 1,389 RNs, I should say, per 1,000 people. It's actually, there's a decimal that should be there. It's 13.89 RNs per 1,000 compared to the national average of 8.43. So it's above the national average. But the reason why we map supply is because you'll see that a lot of counties in our state do not have as large of a supply of nurses because by and large a lot of the nurses are located in, of course, your urban areas. So on all of these maps, the red is usually indicating a much lower supply than average, and the orange is also lower than the national average as well. For LPNs, similar story, although there seems to be a little healthier supply. Blue on my maps always indicates a healthier supply or a better number. So you'll see that the eastern part of the state seems to have a little better supply of LPNs versus the western part of the state. For nurse practitioners by county, we don't really have a national numbers to compare against for population, so this is just raw number of practitioners per county. But you'll see that we have several counties that have 0, and certainly your larger urban areas have a healthier supply of nurse practitioners. For certified registered nurse anesthetists, there's only 321 throughout the state, but you'll notice that they are primarily located in your urban centers. They would certainly be associated with surgery, so I would assume that they would be in the larger hospitals, and certainly few throughout the rest of the state. Certified nurse specialists, there's only 55 in the whole state, and so we produced a map even though there is such a low number. But you'll see that the largest number, of course, is in the Cass County, and there are a few sprinkled throughout the rest. Certified nurse midwives, there's only 17 in the whole state. And so, of course, those are located primarily in your urban centers. As far as demographics for nursing supply, our average age has remained pretty constant across the last 8 years for LPNs, RNs, and APRNs. In fact, we are slightly below the national average as far as age. But if you look at retirement age, and frankly, this graph has looked the same for about the last 14 years, pretty much any time you look at our supply, about 20% or so are going to be retired in the next 5 years, and that's been pretty constant over many years. As far as diversity, our LPN population has become increasingly more diverse. We actually have data on diversity in some of these items dating all the way back to 1998. And you'll see back in 1998, 96% of the LPNs were white, and today 91% are. And so we've had actually about a similar number of Native American, but an increase in other cultures. And as far as diversity distribution for 2015, you'll see the largest minority group is Native American and African American for LPNs. For RNs, we've also had a similar trend in increasing diversity from 90% white to 93% white in 2015. And in 2015, we actually, for the first time I found since I started doing this research, the largest minority group in North Dakota is Asian and not Native American as of last year. We also track male nurses because there is so few of them. And you'll see we've had a slight increase in male nurses since 1998. I don't really know what happened in 2002 to the 3 or 4 male nurses that left for a year and came back and produced that little blip of 2%. But we are, the RNs are about similar to national average. There's about 7% RNs nationally, and 9% of LPNs are male. So we're a bit below the mark in LPNs. So as far as nursing demand and demand demographics, we look at the percentage of nurses that are working full-time. And again, we have this data since 1998. And you'll see that 72% of RNs and 61% of LPNs are working full-time. And it's pretty much stabilized over the last several years. And this is actually an increase over 60% of RNs that are employed full-time nationally. So we have a larger percentage of nurses that are working full-time. But if you look at the other nurses that are not working full-time, we actually have seen a slight increase in the number that are unemployed. So in 2015, 17% of LPNs and 10% of RNs reported that they were unemployed. And if you take this against what we know as unemployment numbers for the state, which are an entirely different measure and parametric, it's pretty startling to see that many nurses that are unemployed, and it certainly is higher than the national average. We actually do ask, the Board of Nursing asks, why are you unemployed? Interestingly enough, these are all the reasons that I would think as to why a nurse would be unemployed. They're either caring for family, that's about a third of them. School is about 14 or 20% of them, they're going on to more school. It's not inadequate salary, that's a really small reason. Disability is about 5%, difficulty finding a job about 5%. It's a lot of other, and I'm not sure what the other is as far as why they're unemployed. As far as employment setting, over the years, you'll see that certainly there has been a shift in where LPNs are employed. You'll see way back in 1998 that LPNs, 31% of them were employed in long-term care, and that's that orange bar on the graph. And today, or in 2015, it was 27%. And a lot of that increase is seen in the other, and that's kind of a trend through a lot of it. There certainly has been a diversification as far as what nurses can do and in settings, and you'll see that in the data. The LPNs are not by and large working in long-term care and hospitals. They're working in a lot of different settings. The pie graph on the right also shows that. These are all the settings that we included under employment settings that they can pick, and you'll see they work in a wide range of places now. In fact, nursing home, where you would think LPNs worked a lot, was about 27% in 2015, and other was 25%. So certainly they're working in a wide range of places. As far as RN employment setting, that has changed and shifted too, although not quite as dramatically as the LPN role. You'll see that actually the yellow again, which is the other, has increased quite a bit over the years. And when you look at just last year, you'll see that a lot of them are still working in the hospital. But again, you got about 20% that are none of these other fields that were listed here. As far as practice areas, where are they working? As expected, the most frequent still was geriatrics, family practice, and med-surg for LPNs. RNs was basically similar, med-surg, geriatrics, and critical care. And APRNs most frequently worked in anesthesia. Of course, those are the certified nurse anesthetists, and family practice. So turning to vacancy turnover and job postings, we measured hospital vacancy rates up through 2013. And then the most recent vacancy rates are available from the Center for Rural Health report that they did in 2014. I understand that they're going to be recollecting that this fall as well. But you'll see over the last few years there has been a little increase in vacancy rates for RNs and LPNs. As far as turnover rates, they are only available through 2013 when we collected them. But you'll notice that they were hovering around 18% for RNs and 14% for LPNs. And what this means in the real world is that 18%, which is close to 20%, means about 1 in 5 RNs change their job over a year. So I liken turnover rates to a measure of chaos in the workforce, because you can only imagine how much time it takes to hire a new nurse and orientate them and get them on the floor or wherever they're working. Other information that's also available, in the 2014 survey done by the Center for Rural Health, there were several hospitals that indicated they had to go on diverse status due to RN shortages. We also surveyed long-term care. They indicated that a large issue for them is high turnover and recruitment of CNAs and nurses. And according to the last report out of the UND School of Medicine, they indicated that with the growth current rate of oral exploration, it's anticipated that the ratio of RNs to population will drop 39% by 2032. I haven't heard if they've updated that information because, of course, we've had changes in our population. Another measure of demand is the number of open positions that are posted. We utilize jobsnd.com, which is the North Dakota job service online posting. They actually use a piece of technology called a spider that goes out to all the different job sites or employers' sites across the state and pulls over their open positions into their system. So it has a larger amount of job openings. And so you'll see for LPNs, there's an average of 111.8 LPN jobs per month across the state. And you'll see how they're split out by county, and that's over for a whole year. So for instance, in Cass County, over a year, there was 546 LPN open positions posted. For RNs, there was an average of 511 jobs per month for 2014 to 2015, and you'll see how they split out across the state as well. For nurse practitioner open positions, we have the same map with the numbers. Of course, the numbers are Grand Forks and Cass are largest, and actually Williams had 75 open positions posted in the year that were measured. And I also pulled the same information back in 2012, where there was an average of 441 job openings, and this increased to 575 job openings in 2015. So certainly over the 3-year period, there has been an increase in the number of jobs posted online. As far as salary, again, I pulled my information for salary from the North Dakota Labor Market Information Center. And I'm just putting this map on here because a lot of the salary information will be shown as far as different quadrants of the state, because the data is split out by the northeast, southeast, et cetera, quadrant. But they also split out the urban areas separately. So when we do talk about southeast quadrant, that does not include Cass and Clay County. So for LPNs, the salary has been below the national average for the last 5 years, even for the experienced LPNs. So the black line is the national salary, and of course the blue is the entry salary, so that's been quite a bit below. And I also have them broken out by area of the state. So I like to tell nurses when I give this presentation, so when you start your LPN career, it appears that you should start in Bismarck, and then you should move to the far west, which would be the Dickinson and Williston area for the rest of your career, because that's where the highest average salary and experienced salary is found. For average RN salary, again, it doesn't matter if you're looking at entry, average, or experience, it's all below the national average. And if you're looking at salary as far as part of the region, the RNs in Fargo have the largest entry and average, and then the largest experienced salary is on the far west. For the average nurse practitioner's salary, they fare slightly better in that their experienced average at least is over the national average, although they are also below the national average for entry and average. And in the case of nurse practitioners, if I was to give advice, should work in the Far East area. That has the largest entry salary, but remember that does not include Grand Forks and Cass, Clay County with Fargo. And then the largest average salary, so they would be working in Mayville or Wahpeton or other areas. And then in the far west, they have the highest experienced salary. For nurse anesthetists, they fare better in that at least their average is over the national average and they're experienced. The nurse anesthetist and the nurse midwife salaries are not available broken down by region because of the small numbers. The nurse midwife salary actually fare pretty well. Our 17 or so nurse midwives get paid pretty well as compared to the national average. So if we look at future supply and demand and long-term historical supply, one way to look at it is to look at the licensure data from the Board of Nursing. They keep track and have been for a number of years. I have on the slide since 1990. The number of nurses that have entered our workforce by license, by exam, and by endorsement. So those nurses that enter by exam, by and large, are graduates of our programs that have then taken the licensure exam and then are licensed. The ones by endorsement, by and large, are those that are transferring from out of state. And so you'll notice kind of an interesting trend for the RNs and APRNs. Starting in about 2010, 2009, the number of transferred nurses went over the number of licensed by exam, meaning that we started to bring in a whole lot more nurses from out of state than we were producing within our own state. And pretty much before that, other than a few little blips, it pretty much stayed, we were producing more than we were bringing in. For LPNs, it pretty much, we certainly produced most of our LPNs, and some are transferred in. And so if you look at all those lines together, you'll see that the RN, APRN supply has kind of had a gentle sloping increase If you recall, we saw an increase in the number of graduates from the education program. So they had ramped up production of nurses in the 2004-2005 years up to this point. And we're starting to also bring in more nurses from out of state. LPNs have been pretty flat. I mean, they have increased a little bit, but certainly nothing dramatic. As far as demand projections, again, I get this information from the Labor Market Information Center. I mentioned earlier that all of the different occupations are high growth, bright outlook occupations, and that's because they have quite a bit of growth. You'll see that for until through 2022, that all of the nursing occupations have a growth of over 20%, with the highest being 30%. So the Labor Market Information Center is indicating that nurse practitioners in particular will grow by 30% between over those 10 years. And if you look at historically demand estimates using the same source, you'll see that the RNs have gone up as well, and the LPNs have had a gentle little slight increase in the slope. We have produced supply and demand projections for a number of years. I utilize the demand information from Job Service. So all the dark red line is directly from the Job Service demand projections I just showed you. And then I also add a low demand and high demand because supply and demand projections are an art. It's hard to predict a lot of changes in the field. And so the demand projections, they are based on a national model through the U.S. Bureau of Labor Statistics. Sometimes they may not be as accurate in some healthcare occupations, especially in areas with a large number of elderly and rural populations. So I add this high demand and low demand line. Also, we're not really sure what the impact of the Affordable Care Act is going to have on nursing supply. So that's also why we have this margin of error, essentially. The blue lines are ones that I produce based off of all of the data that we have over actually many years. I actually have supply data that I based in my model back to 23 years. But you notice that there has been some changes, especially in the supply, in the last 5 years. So I thought it would be interesting to see if there was a difference. And you'll notice that if you just look at our supply in the last 5 years, you'll see that it produces a shortage currently, and one that will alleviate around 2020 or so as far as staying in between the supply and demand lines. So right now we're projecting a shortage in RNs as compared to demand. And if you believe that the Affordable Care Act is going to increase demand, which I think a lot of people do, probably more accurate to look at the top dotted red line for that. For the LPN supply, it doesn't matter what line you use, high demand, low demand, regular demand, they're all way below. And we started projecting LPN shortages about 4 years ago. Before that, there was a pretty healthy supply. So as far as conclusions and policy recommendations, certainly we have 16 nursing education programs, and they have more applicants than available by and large, for admission slots. For those that aren't full, they are actually working together to try to direct applicants that don't get in to other programs where there is open slots. There's also been an increase in faculty positions, or vacant faculty positions. We actually have a faculty policy brief that talks about ways to incentivize faculty to work in North Dakota. We also, and frankly, this finding has been here for the last 14 years. And when I talk to news reporters, for instance, about nursing shortages, in a rural area, when you have, say, 10 nurses and you have 2 retire, that is a pretty large vacancy rate for that small facility. It is pretty hard to bring in a new nurse to a rural area, and any decrease or moving of nurses creates quite a bit of, sometimes I would call chaos and turnover, and it's hard to recruit nurses to rural areas that don't already live there. And so, the urban areas are also, a lot of times, don't have an adequate supply either, and a lot of that is due to building of new facilities and bringing in new programs. We also have a large number of unemployed nurses, which I find is interesting since we have such a good economy. So certainly try to encourage unemployed nurses to rejoin the workforce would help. Regional differences in salary, but by and large, they're pretty much below. And so when I have healthcare facilities ask me about what they can do about salary, I know it's unrealistic for most healthcare facilities to try to match the national average, but moving towards the state average might help. And I have had a number of facilities over the years request the salary information for me so that they can push within their own facility to at least get to the state number. There have also been a number of increase of nurses transferring into the state, so certainly encouraging them to stay would also help our supply. And there's certainly, we're still showing shortages, so certainly working along different multiple sectors to ensure a healthy supply of nurses will help our future as well. So I wanted to point out at the Center for Nursing, we have several nursing workforce policy briefs. I mentioned that we do have some ideas on how to increase faculty recruitment. We also have advanced practice registered nurse preceptor reimbursement, because one way to, if you want to increase the capacity of your education programs, you first have to get faculty, but you also have to have preceptors to help with the training. And we also have a behavioral health nursing policy brief. And as far as our strategic plan, this information is also available in all of our platform programs. But the Center for Nursing itself, although I've been doing research in nursing workforce research for 14 years, the Center for Nursing was actually developed in 2011 as a nonprofit to create a vision for a unified voice in nursing excellence. And over the last 5 years, we developed a number of platforms to help across a wide array of workforce programming. And so those are all listed here under the platforms. And all the information about our programs are available on our website. You can actually look on there and see what we're doing for faculty development or nurse recruitment. We have several resources on our website designed to help with workforce planning. Also today, in a couple of hours, if you want to, you can actually purchase a contact hour. If you want board of nursing contact hours, you can go on there. We did get approved for 1.0 contact hour for this webinar. And you can download the slides at this link as well. We will be posting this information on our website and on our Facebook as well. So I'm going to try to unmute the call and stop the recording so we can do questions.